I get to say this again. Good morning, New York! I'm Kelsey Louie, the proud CEO of GMHC. On behalf of the entire staff, board, and clients of GMHC, I want to thank you all for being here today and for being here for the past 30 years. As we reflect on those 30 years, we must pay special thanks to our long-term survivors. Without them, our victories over the last 30 years would not have been possible. We have 3 of those warriors with us here on stage. Eric, Nancy, and Ramon, your strength and resilience inspire all of us. Thank you. I also want to thank Craig Miller, who had the vision to create AIDS Walk New York 30 years ago. And thank you to the entire AIDS Walk New York team for your tireless efforts and wonderful partnership. Let's give it up one more time for Dwayne Reed, Gilead Sciences, Bristol Myers Squibb, and Quest Diagnostics. Your steadfast commitment to end AIDS is the definition of meaningful corporate responsibility. I'd also like to extend my heartfelt thanks to the GMHC Board of Directors, especially our co-chairs Michael Harwood and Robbie Kaplan. And to the Community Advisory Board Chair Manny Rivera and all of the men and women we serve at GMHC. Thank you for your guidance and support. I stood on this stage 1 year ago as the incoming CEO of GMHC. How incredibly productive these past 12 months have been. This past March, I had the honor of bringing Larry Kramer, one of our original founders, back into the open arms of GMHC, his first child. Without Larry Kramer, there would be no GMHC. So what makes GMHC so great? The answer is simple. We simply save lives every single day. GMHC serves over 9,000 people impacted by HIV and AIDS, more people than ever in our history. At our testing center, we test nearly 3,000 people for HIV, and 90% of the people who test positive at our testing center become virally suppressed, more than double the citywide average. We also serve 90,000 hot meals to those who are struggling to get by. And this year, we will expand to provide mental health and substance use services in addition to comprehensive STI testing. All of this will further empower our clients to get and stay healthy. During these past 12 months, I've made sure that every dollar, every resource available to GMHC is used as efficiently as possible. This meant directly addressing challenges with our building, and I'm proud to say that we are combining 2 floors into one, saving 25% in rent each year, freeing up even more resources to fight HIV and AIDS. We also continue our strong tradition of advocating at all levels of the government. 30 years ago, the White House was silent in addressing the AIDS epidemic. Today, the director of the White House Office of National AIDS Policy, Douglas Brooks, is here with us. But we can't just talk the talk. We have to walk the walk. While we work to lower new HIV infection rates, we must also increase public pressure on all fronts to find a cure. AIDS is no longer a death sentence thanks to advances in medical treatment. But today's advances, in many ways, are yesterday's advances. Will people with HIV always have to live with kidney and bone density monitoring, fear of premature aging, and a long list of other side effects? We can no longer be complacent. Over the past 30 years, we have learned that silence equals death. We must demand better treatments for those affected by HIV and AIDS. When, for instance, did HIV organizations start agreeing that treatment decisions should be made by insurers and expert panels, not by patients and their doctors? When did preferred drug lists, high copays, and specialty tiers become acceptable? We must go further. Our collective aspiration should be nothing short of a cure. Only if we aspire to more can we demand more. Only if we demand more will we get more. We've been walking for 30 years and we will continue to walk until we find a cure. Thank you all.